There are 3 different types of hair transplant surgical techniques. There's a traditional strip technique, otherwise known as follicular unit grafting, or F.U.G. That's the technique where we take an actual strip of tissue from the back of one's head, and that is actually sometimes called the strip technique. That does get closed at the immediate time of surgery that will eventually leave a very fine line scar that if you shave your hair shorter than a buzz cut of a 4, you will see that fine line scar. But that does leave an ability to take a great amount of hairs at once and gives a great result. We also have F.U.E, follicular unit excision, which takes hairs one by one from the donor area in the back of the head. And we call that the virtually scarless technique, because even if you buzz cut shorter than a 4, it's very hard to see all of those little donor sites scattered throughout the back of the head. The third technique would be called the no-shave technique, or long hair F.U.E. And the great thing with that is that we don't actually have to shave the donor area to take those individual hairs. We are going amongst your long hair, your uncut hair, to take out those individual hairs. So there's no period where this shaved donor area in the back of the head has to regrow. As you can imagine, that is a time-taking technique because we have to go one by one in between long hairs. It's a lot easier when we shave that area. But that is really the premium technique that we do for patients who really want to be undetected and have really never a time or not a day, a moment where anyone can detect that something has been done. To learn more about hair loss and to understand more about hair transplant surgery, please visit my website at www.drhalaas.com, www.drhalaas.com.